Good morning, esteemed colleagues and health enthusiasts. Today, we delve into an important and prevalent health issue, bronchitis. As a respiratory condition that affects a significant portion of the global population, understanding bronchitis is crucial for both healthcare professionals and the general public. My aim is to provide you with a comprehensive overview, blending scientific insights with practical advice, to enhance our collective understanding and response to this condition. Let's start with some sobering statistics that highlight the significance of our topic today. Bronchitis, both in its acute and chronic forms, poses a considerable health burden worldwide. Acute bronchitis affects millions globally each year, making it one of the most common respiratory infections. While it is generally self-limiting, the discomfort and temporary reduction in quality of life cannot be overlooked. On the other hand, chronic bronchitis is a more severe and persistent condition, classified under chronic obstructive pulmonary disease, COPD. According to the World Health Organization, WHO, COPD is the third leading cause of death worldwide, causing 3.23 million deaths in 2019 alone. Chronic bronchitis accounts for a significant portion of these COPD cases, affecting an estimated 9 to 10% of adults aged 40 and above in various populations. These figures underscore not only the widespread prevalence of bronchitis but also its potential to significantly impact health outcomes and quality of life. Understanding the risk factors and symptoms is the first step in combating this global challenge. Bronchitis arises from the inflammation of the bronchial tubes, the major airways into the lungs. This inflammation results in coughing and production of mucus, among other symptoms, impacting the individual's ability to breathe comfortably. Acute bronchitis, most commonly triggered by viral infections. Acute bronchitis shares many pathogens with the common cold and influenza. Environmental factors such as exposure to tobacco smoke, pollutants, and dust can exacerbate or even trigger the condition in susceptible individuals. The primary symptom is a cough, which may be dry or produce mucus, and can last from a few days to several weeks. Other symptoms include sore throat, nasal congestion, fatigue, and a mild fever. Chronic bronchitis, a form of COPD, is primarily caused by long-term exposure to tobacco smoke, air pollution, dust, and chemical irritants. Unlike its acute counterpart, chronic bronchitis is characterized by a persistent cough that lasts for at least 3 months, with recurring bouts occurring for 2 consecutive years or more. Symptoms include a chronic productive cough, wheezing, shortness of breath, and frequent respiratory infections. The chronic inflammation leads to scarring and narrowing of the bronchial tubes, progressively impairing lung function. Continuing our exploration from the analysis of bronchitis causes and symptoms, we now transition into a detailed examination of prevention and treatment methodologies for both acute and chronic bronchitis, highlighting practical, evidence-based strategies. The multifaceted nature of bronchitis necessitates diverse prevention approaches, intricately weaving together environmental considerations and personal health practices. In addressing acute bronchitis, infection control becomes paramount. Frequent hand-washing and the judicious use of hand sanitizers play a significant role in mitigating viral transmission risks. Seasonal strategies, especially during flu season, such as minimizing contact with infected individuals and avoiding densely populated areas, are effective in curbing exposure. Moreover, vaccinations, including annual flu shots and pneumococcal vaccines for those eligible, serve as a preventive bulwark against respiratory infections potentially escalating into bronchitis. Environmental vigilance, through reducing exposure to air pollutants and indoor irritants like tobacco smoke and harsh cleaning agents, further shields individuals from the onset of acute bronchitis. Turning our focus to chronic bronchitis, cessation of smoking emerges as the cornerstone of prevention, effectively halting the progression of the disease. Supportive measures, including smoking cessation programs, offer vital assistance in this endeavor. Protective strategies against pollutants, such as wearing masks in contaminated environments and advocating for clean air indoors, alongside occupational safeguards for those exposed to hazardous materials, underscore the comprehensive approach needed to prevent chronic bronchitis. The therapeutic landscape for bronchitis, distinct between its acute and chronic forms, prioritizes symptom alleviation and lung function enhancement. For acute bronchitis, symptom management through over-the-counter medications, such as pain relievers for discomfort and cough suppressants or expectorants based on the cough's nature, provides relief. The addition of humidifiers and ample hydration aids in easing breathing difficulties. Rest and increased fluid intake are advised to foster recovery, with antibiotics reserved for instances suspect of bacterial involvement, acknowledging that viral agents predominantly cause acute bronchitis. Conversely, treatment for chronic bronchitis incorporates bronchodilators to ease airway constriction and inhaled corticosteroids to combat airway inflammation, aiming to forestall exacerbations. Pulmonary rehabilitation, an integrative program encompassing exercise, nutrition, and disease management education, markedly elevates life quality for sufferers. Advanced stages may necessitate oxygen therapy, underscoring the disease's severity. Regular vaccinations against flu and pneumococcal infections are advocated to avert complications that could aggravate the condition. Understanding when to seek medical assistance is a critical aspect of managing bronchitis effectively, as early intervention can prevent the condition from escalating into more severe complications. Recognizing and responding to the signs that necessitate a doctor's attention can significantly influence the course and outcome of the treatment. Medical consultation should be sought without delay if severe or persistent symptoms emerge, such as pronounced difficulty in breathing or wheezing, which could indicate obstruction or inflammation of the airways requiring immediate attention. Similarly, severe chest pain, particularly if sharp and exacerbated by coughing or breathing deeply, may suggest complications such as pneumonia, necessitating urgent medical evaluation. A high fever, surpassing 100.4 degrees Fahrenheit 38 degrees Celsius, especially when accompanied by chills, is often a sign of bacterial infection or another underlying condition that could complicate bronchitis, thus requiring professional medical intervention to determine the appropriate course of antibiotics or other treatments. The presence of discolored mucus, yellow, green, or even blood-tinged, signals a potential bacterial infection or, in more severe cases, damage to the lung tissue, both of which require prompt medical assessment and treatment. Moreover, symptoms persisting beyond 3 weeks could indicate the transition from acute to chronic bronchitis or the presence of other serious conditions, underscoring the need for a comprehensive medical evaluation to adjust treatment strategies accordingly. Ignoring these signs and delaying treatment not only risks exacerbating the initial condition but also increases the likelihood of developing serious complications such as pneumonia, which can significantly impair lung function, and in the case of chronic bronchitis, can accelerate the progression to advanced chronic obstructive pulmonary disease, COPD. Such progression can lead to a marked decline in quality of life and potentially life-threatening respiratory failure. In conclusion, the intersection of recognizing critical symptoms and seeking timely medical intervention forms the cornerstone of effective bronchitis management. It underscores the importance of being vigilant and proactive in health management, especially in conditions like bronchitis, where early detection and treatment can prevent significant complications. As we navigate through our health journeys, let us remain committed to staying informed and engaged, ensuring that we can respond promptly and effectively to health challenges, thereby safeguarding our well-being and enhancing our quality of life.